Hello, welcome to my YouTube channel. My name is Chuta Aki, and today we are going to discuss about cardiovascular system, specifically hypertension. Hypertension is elevation of systolic or diastolic blood pressure, and there are two types of hypertension. There is a primary hypertension, which there is no medical cause, and secondary hypertension uh, is caused by other diseases such as pregnancy, thyroid disease, coarctation of aorta, phagocytochromocytoma, hyperaldosteronism, renal diseases. There are two risk factors. There is non-modifiable factors and modifiable factors. Non-modifiable factors are factors that you cannot change, such as family history, gender. Men has a greater risk of getting hypertension than female. Races, blacks has a higher risk of hypertension than other races. Age. Modifiable factors are factors that you can change, such as obesity, stress, high sodium diet, saturated fats, alcohol, tobacco use, sedentary lifestyles, oral contraceptives, physical inactivity, low sodium diet. Signs and symptoms. They are not really signs and symptoms of hypertension until vascular changes has occurred in the heart, kidney, and brain. And some of these symptoms you see after vascular changes has occurred are headache, flushed face, dizziness, vision like double vision, chest pain, shortness of breath, palpitations, swelling. Swelling happens mostly in uncontrolled hypertension and is mostly seen in the feet and ankles. Diagnosis and laboratory findings. There are several ways of diagnosing hypertension. One of the ways is doing 3 readings on a separate occasions. For example, maybe every 2 weeks times 3, and if the blood pressure is greater than 140 out of 90 in a younger person less than 50 years, or blood pressure greater than 160 out of 90 for a person older than 50 years, then they can determine a person has an hypertension. Also, increased protein in the urine, increased PUN and creatinine levels. They can also do a chest radiography or ECG or EKG, and if it shows a left ventricular hypertrophy, they can say somebody has a high blood pressure. Also, they can do intravenous, which is IV pyelography and renography. And if it shows a renovascular disease, then they can diagnose someone has a hypertension. Next, we are going to discuss about nursing interventions. What can a nurse do for a patient who has hypertension? One, a nurse can obtain blood pressure on both arms and compare blood pressure with a prior documentation, identify current medication, obtain weight, evaluate sodium intake, assess facial changes and retinal damage, assess renal function, evaluate labs results and diagnostic studies, assess cardiovascular changes such as dysrhythmias and elevated heart rate, Next, we are going to discuss about patient and family teachings. As a nurse, what are you going to teach the family and the patient? You can instruct the patient to reduce weight, teach the patient to restrict sodium intake, teach the patient to avoid smoking, alcohol, and caffeine, instruct the patient to do physical activity and exercises regularly, promote relaxation techniques, regular blood pressure monitoring, avoid canned food since canned food usually has a high sodium. Discuss the importance of lifelong medication follow-up examination. Thank you for watching my YouTube channel. If you like it, please comment, subscribe, and share with your friends.